Hi, I am Tamanna Motahar, and I am presenting our research on identifying factors that inhibit self-care behaviors of people with severe spinal cord injury. This is work I did with Isha Ghosh and my advisor Jason Wiese at the University of Utah. Take a moment to think about how long it has been since you last stood up from your seat. Common recommendations are to stand up and move around every 30 minutes. Perhaps some of you even have a wearable that reminds you to do this if you forget. Do you follow it? Now consider that a person with a spinal cord injury using a wheelchair needs to change their sitting position called the pressure relief once every 20 minutes. This is 3 times an hour or approximately 30 to 50 times each day. Imagine how hard it is to adhere to this critical self-care behavior. These pressure reliefs are necessary to prevent the occurrences of pressure ulcers, which require medical treatment, can be painful, and can even be life-threatening. Pressure relief is one of many self-care activities that people with severe spinal cord injuries need to perform. Some self-care activities need to be performed multiple times a week and others multiple times a day. Finally, there are some activities that need to be performed multiple times an hour. Among all of these self-care activities, pressure relief is the most frequent self-care activity and is the focus of this work. Getting pressure ulcer can be very serious. Unfortunately, it is very common for someone with a spinal cord injury to develop a pressure ulcer. More than 80% of patients develop at least one pressure ulcer in their lifetime. This is also a common cause of hospitalization, and having a pressure ulcer has negative impacts on quality of life. For instance, individuals need to spend more time in bed and in hospitals. There is a risk of infection, and there is a decreased possibility to return to work. The good news is that pressure ulcers are preventable, and one way to help prevent them is by performing pressure reliefs. Pressure relief involves regularly changing one's sitting position for a certain duration to reduce tissue load. Manual wheelchair users perform pressure relief by leaning forward, backward, or to the side. On the other hand, power wheelchair users who typically have more severe motor impairments perform pressure relief using the tilt function of the power wheelchair to shift the tissue load to their back. In this study, we explored power wheelchair users' experiences in performing pressure relief to help us understand how technology might be able to better support this high-frequency activity. Our first research question focused the current pressure relief behaviors and experiences of power wheelchair users. We also explored some design considerations for technology to support adherence to pressure relief guidelines. Our study involved two phases. First, we conducted semi-structured interviews about participants' pressure relief behavior. We then presented 9 storyboards with imaginary technological interventions to each participant and solicited their reactions to each one. We used prior literature to inform the scenarios we developed, including ideas such as shareable form factors, mobile interventions and feedback, collaborations with stakeholders, and accessibility in different contexts. Here is an example scenario of a storyboard from our study. It says, after finishing breakfast, Bob was taking a rest alone. While he was resting, he felt a vibration on his armrest. Bob remembers that he has not done a pressure relief for a long time. Bob is thankful for the reminder as he often forgets to do his pressure reliefs without that vibration. In each scenario, we varied 5 dimensions that we integrated into the story: trigger, modality, interactivity, purpose, and social setting. For instance, in the example scenario I just read, it had an automated trigger. The modality was through vibration. The interactivity was through a shareable form factor. The purpose of the technology in this scenario was to provide a reminder, and the person in the storyboard was not around anyone else. We recruited 7 participants who were power wheelchair users from the United States and Canada. Our participants' spinal cord injuries had happened between 4 and 38 years earlier, and all of them had experienced multiple pressure ulcers. Participants also have multiple comorbidities and a wide range of functional abilities. Some had the ability to use their hands, others primarily relied on their head and mouth to control their power wheelchair and other devices. Despite having had pressure ulcers and being worried about future pressure ulcers, participants all self-reported routinely missing pressure reliefs. One primary reason for this is that they rely on their internal awareness of the time and feelings of pain to remember when they should perform pressure relief. Additionally, they were not confident about what their ideal pressure relief behavior should be. For instance, participants 2 said that they should do a pressure relief once every 15 minutes, and participant 6 thought that the ideal pressure relief frequency is once every 4 hours. These perceptions of ideal pressure relief behavior vary dramatically from each other. Even when participants remembered to do a pressure relief, they did not always perform one, as there are other contextual factors at play. For instance, using the tilt function of a power wheelchair to perform a pressure relief requires sufficient spaces, which can be difficult in some settings. Furthermore, as it is a highly visible health activity, participants reported sometimes feeling socially awkward to perform pressure reliefs in settings where it might be distracting or draw unwanted attention to them. In reaction to the speed dating scenarios we presented, participants strongly favored appropriated charitable interactions to smartphone based ones. Charitable systems would be more convenient for them in terms of control and reachability. Participants also noted that a reminder for every pressure relief would be burdensome because of the large number of pressure reliefs they need to perform every day. Rather, they only wanted reminders for missed or unfinished pressure reliefs. Additionally, they wanted the reminders to be private, reminder modes to be based on their physical abilities, and for the reminders themselves to vary depending on their social and situational context. These results help illustrate just how difficult of a situation these participants are in when trying to adhere to pressure relief guidelines. While forgetting is one reason for not performing a pressure relief, it is not only the reason. There are contextual factors that impact their pressure relief performance. There is also incredible potential for personal informatics to support these individuals in performing pressure reliefs with other self-care behaviors they must follow. Unfortunately, to date, personal informatics has almost completely ignored power wheelchair users. Finally, I would like to thank you for your interest in this work. This paper contains many more details, and I would like to invite you to please reach out to us if you have any questions or would like to discuss this topic further. Thank you so much.